Thank you also to Lachance for inviting me to share with you some ideas based on we have been discussing this in this webinar about functional feeds and how some feed additives can help in shrimp health and performance. And so my idea now is to show you, let's say, a way of thinking in how to develop, these solutions in order to improve the performance of shrimp. And this is basically based on my experience working in salmon and shrimp. So I will not talk too much about the hepatopancreas, and we all know that is probably the most important organ in the shrimp, and is involved in the immune response of the shrimp. Is also involved in digestion, absorption, storage of nutrients, metabolism, and basically, if we make a comparison between the liver and the hepatopancreas, certainly the hepatopancreas has much more functions than the liver, in mammals. There are differences in the structure. The liver has is composed of a parenchyma divided into irregular lobules, and it has hepatocytes. The hepatopancreas, on the other side, consists of numerous blind-ended tubules enveloped in a muscle net of longitudinal and circular fibers. And the tubule contains various cell types, as has been mentioned before, the R cells that are involved in absorptive and metabolic functions, the F cells involved in the synthesis of digestive enzymes and blood proteins. Then you have the B cells involved in nutrient absorption, and the E cells that are, let's say, replacing cells. In terms of the histology, the tubules in hepatopancreas are divided in distinct zones. The distal zone, where the R cells are located, the medial zone with differentiating cells, and proximal zone with the F and B cells. So the primary function, as I said before, in the case of the liver, is involved in metabolism, detoxification, and storage of nutrients. It also synthesizes protein. It has the detoxified channels and produce bile. On the other side, the hepatopancreas is involved in the digestion and absorption of nutrients, the storage, metabolism, and immune response. It also synthesizes digestive enzymes and lipoproteins. So it's let's say it's a mix of liver function, intestine function, and pancreas function. So if we look at the healthy hepatopancreas, right, you can see here the tubules, that are very clear and well formed. You have nuclei, and then these tubules are surrounded by connective tissue. You have the tubule lumen, and the vacuoles. So this is how healthy hepatopancreas look like. So if we start looking at what are the factors that normally affect the hepatopancreas, we can see that there are many, in shrimp farming. I will just talk about a few of them, just to exemplify what I would like to discuss. So we have the hepatopancreatic microsporidiosis, EHP, right? If we look at the symptoms, basically this disease affects the performance of the shrimp, but there is also a downregulation of lipid metabolism. So elongation and degradation of fatty acid, the biosynthesis of unsaturated fatty acids, and the metabolism of alpha-linolenic acid, sphingolipid, and glycerolipids are affected. And also there is a reduction in the synthesis of digestive enzymes. Also, there is a decline in triglycerides, total protein, cholesterol, and glucose. If we look at the histopathology of this disease, where you can see that there is necrosis of the tubules and the epithelial cells. okay? And there is also disruption of the non-specific immune response, okay? Including the decrease in activity of alkaline phosphatase, catalase, GGT, total antioxidant capacity, phenol oxidase activity, and there is also reduction in total hemocyte count. So there is an impairment clearly of the immune response. And then you have acute hepatopancreatic necrosis disease produced by Vibrio parahemolyticus. And this Vibrio synthesize some toxins, PR and PRB, that they form pores in the membranes of target cells, okay, leading to the death by osmotic lysis. And the clinical signs is loss of appetite, empty stomach, and whitish and atrophic hepatopancreas. The toxins induce a necrosis of the epithelial cells, hemolytic infiltration, and the presence of bacteria, leading to the generation of the tubules, okay, which in an advanced stage of the disease results in dysfunction of the hepatopancreas and ultimately death of the animal. Here you can see a picture of histopathology, okay, of EHP, where this is development of the disease from 15 days per challenge up to 90 days per challenge, and you can see in the circles heavy necrosis of the hepatopancreas tubules, and here on the right you can see also severe necrosis of epithelial cells. So there is certainly a heavy damage to the hepatopancreas. Other diseases that can affect the hepatopancreas is the white feces disease. You can see these fecal streams floating in the water surface, coupled with anorexia, lethargy, and significant declines in shrimp health. There is a reduced growth, and of course, this disease affects significantly the performance of the shrimp. But if we look at the histopathology, there is a severe damage in the hepatopancreas, including lysis, necrosis, and atrophy. There is also sloughing of hepatopancreatic microvilli. In the intestines, there is necrosis and vacuolation, indicating excessive cellular death, okay, and tissue degradation. And of course, there is the digestive and absorption of nutrients is compromised, leading to a deterioration of the health and reduce the survival of the shrimp. Then we have necrotizing hepatopancreatitis caused by Helicobacter peniae. Also affects performance, but there is also a soft shell, flaccid body, and black gills, and you can see an empty intestinal tract. And the hepatopancreas will suffer some degenerative signs and atrophy. Okay. In the acute phase of the disease, there is clearly an atrophied hepatopancreas, and there is an inflammatory infiltration of with hemocytes. Okay, so every time we have an increase in the number of hemocytes in the hepatopancreas is an indication of an inflammatory reaction and of the innate immune response. And there is also atrophy and necrosis of the epithelial cells, okay, in the tubules. In terms of environmental factors, we have ammonia, for example. High levels of ammonia can decrease the activity of energy metabolizing enzymes and increase also immune enzymes activity. The immune enzyme activity is decreased. Okay, and there is also an affection to the synthesis of purines, pyrimidines, metabolism, and also of folic acid. And if we look at the histopathology in a first stage of exposure to ammonia, like 12 to 24 hours, there is a deformation of the tubules. There is an increase in the number of vacuoles and thickening of the basal membrane. And then with more time of exposure, there is a large number of vacuoles in the tubules, and there is also more deformation and more damage to the epithelium. Okay, So here you can see a healthy hepatopancreas, right? And then you have the time of exposure on 12, 24, 48, 72, and 86 hours. And you can see how the damage over the hepatopancreas is increasing over exposure time. Another environmental factor could be a low oxygen level, hypoxia. So short-term exposure to hypoxia triggers an adaptive response in shrimp. Hepatopancreas characterized by increased expression of hypoxia-induced factors and antioxidant enzymes like manganese superoxidase mutase and glutathione peroxidase. And these responses help to mitigate the oxidative damage initially. Low oxygen also reduce overall shrimp growth and survival. And this is due to combined effect of oxidative stress and metabolic disruptions. When we look at the histopathology, the prolonged exposure to low oxygen levels overwhelm the shrimp antioxidant defense, leading to increased apoptosis and histopathological lesions. This suggests a loss of antioxidant capacity and increased cellular damage over time, and of course, the presence of oxidative stress. So this is normal oxygen levels. Here you can see normal and healthy tubules, but as low oxygen continues over time, you can see a reduction in the or an increase, let's say, of the pathology in the hepatopancreas, leading at the end with a very thinner epithelial cells, as you can see here. Mycotoxins. Now we talk about toxins, and mycotoxins also are important factors in damaging the hepatopancreas. Aflatoxin B1, for example, not only affects the performance of the shrimp, but also change the color. The hepatopancreas is pale. The activities of digesting enzymes are inhibited, and there is also damage over the immune response, and there is an oxidative stress. And this can be shown here in this study where they tested different doses of aflatoxin from 0 to 4 milligrams per kilo. You can see that the total hemocyte count, the phagocytic activity, and antibacterial activity are all damaged or reduced because of aflatoxin contamination. And if we look at the total antioxidant capacity, the levels of superoxidase mutase are reduced because of aflatoxin, and then there is an increase in malondialdehyde, that is the end product of oxidation. So there is an increase in oxidation because of that. And in terms of histopathology, there is a delamination, vacuolization, and atrophy of the hepatopancreas. There is rupture of epithelial cells, loss of R and B cells, okay? And in the intestine, there is exfoliation of the epithelial cells. Fumonisins, so here is a combination of aflatoxins with fumonisins, but basically, besides the performance damage, there is also loss of star shape of the lumen of the tubules in the hepatopancreas, and there is also necrosis. Both mycotoxins cause displacement of the epithelium, allowing interstitial space and sites with hemocyte infiltration. So there is also an inflammatory response. There is atrophy and deformation of the tubules, and there is also hyperemia and the presence of necrosis of the R cells. Okay, that will be the absorptive cells. And then we have T2. It's also an important mycotoxin, and it also affects performance, of course, and also compromise the antioxidant system, increasing the levels of MDA in the hepatopancreas. And here you can see a study where they tested different doses of T2, okay, from a control to 12.2 milligrams per kilo of T2. You can see that in the highest doses of T2, there is an increase in oxidation, an increase in MDA. The levels of glutathione peroxidase and total antioxidant capacity also increase, even though in the highest dose they are compromised. So the same for catalase, superoxidase mutase, and glutathione. So if we look at the histopathological effects in a middle dose, like 2.4 milligrams per kilo, there is a reduction in the number of R and B cells. There is a marked vacuolation and cellular degeneration, okay, with nucleus swelling, resulting in expansion of nuclear membrane and disintegration of cellular membranes. And then if you go at the highest level, the most toxic one, there is practically disappearance of the cell nuclei, and there is absence of BRR cells, okay? And there is, of course, necrosis and lysis of cells. So it's a very dramatic effect. Okay, so until now, I've been discussing basically those factors. There are more than this, of course, but there is no time to discuss everything. But my idea was to basically understand what is the consequence of these factors into the pathology of the shrimp, and especially on the hepatopancreas health, because that will give us some clues on how to design, okay, some strategies that can help us to cope with these problems through the feed. Okay, so if we summarize here the stress condition like ammonia, nitrates, temperature, salinity, hypoxia, there is a common factor in most of these problems that is an oxidative stress situation. Okay, there is some other, for example, ammonia. There is also dysbiosis in the gut. Okay, so yeah, so and for example, in the case of alkalinity, that I didn't talk much about that, but it's also affecting the immune response. So the mitigation could be basically thinking about how we can support the antioxidant system of the shrimp, and using natural antioxidants seems to be a good alternative, as well as biotics. When I talk about biotics, I talk about probiotics, prebiotics, postbiotics, symbiotics, etc. So those are also options because of the dysbiosis induced by these ammonia and nitrates. And basically, in alkalinity, we can also use an immune regulator in order to improve the immune response. When we talk about diseases, basically, the mitigation factors, for example, in white spot disease, we can use immune stimulants, nucleotides, natural antioxidants like polyphenols, anti-inflammatory compounds, and phytobiotics. In the case of hepatopancreatitis, microporidiosis, we can use nucleotides, natural antioxidants, polyphenols, and bile acids. In the case of acute hepatopancreatitis necrosis disease, also nucleotides, natural antioxidants, anti-inflammatory compounds, biotics, essential oils, short-chain fatty acids, phytobiotics, and bile acids. White feces disease, nucleotides, biotics, and bile acids. And finally, NHP, we can use nucleotides, natural antioxidants, anti-inflammatory compounds, biotic essential oils, short-chain fatty acids, and phytobiotics. So basically, I mean, when I discuss about mitigating factors, is basically looking for those ingredients or those compounds that can counteract, okay, the damage induced in the hepatopancreas and in other tissues by these diseases. Okay, so basically what I'm trying to do is to combine, okay, different feed additives or different compounds in order to protect and mitigate the consequence of these factors. Okay, and in case of the mycotoxins, we can use, in the case of aflatoxin, natural antioxidant, absorbents, of course, of mycotoxins, an hepatoprotector, phytogenics, digestive enzymes, secretagogues, nucleotides, and bile acids. In the case of homonyces, anti-inflammatory agents, absorbents of mycotoxins and nucleotides. And finally, in T2, we can use natural antioxidants, polyphenols, nucleotides, absorbents of mycotoxins. So just a couple of examples of this. Here is a study where they tested the different bacillus strains or isolates, okay, to counteract the infection with Vibrio parahemolyticus. In this case, you can see the % survival, okay, of the shrimp after a challenge. And those shrimp were fed with different strains of bacillus, and you can see that here you have the highest mortality of course, is here in the control group. And there is also one strain of this bacillus, the K13, that also didn't help at all in terms of survival. But you can see that the other strains and the other bacteria or probiotics were able to protect. And some of them, like K3, was the best of all. Then they tested K3, the best performer here. They tested in different salinities. You can see that the mortality increases significantly with increasing the salinity in the shrimp. However, when you use this strain of Bacillus, that is Bacillus subtilis, you can see that there is a significant decline in the mortality. Another example, in this case, of phytobiotics, in the case of hepatopancreatic necrotic disease, again, there is a mix of thyme and cinnamon in this case. That will be diet E, and diet F is oregano and cloves. You can see that both in the percentage mortality and the percentage of carriers or shrimp that carried the bacteria, after the challenge on the survivals, you can see that there is a decline both in mortality and in the carriers with the use of diet E with thyme and cinnamon. Oregano and cloves didn't have much benefit. Bile acids, we have mentioned during the webinar on the use of bile acids. In this case, this is bile acids controlling or helping to mitigate aflatoxin. So in this case, they have 3 treatments: a control group, then a shrimp that were fed aflatoxin, and then aflatoxin with bile acids. In this case, they use 0.3 grams per kilo of bile acids. And you can see that the performance of the shrimp were improved with the bile acids. Also, there is an increase in the digestive enzymes that were declined with the aflatoxin. And then if you look at the total counts of hemocytes, phagocytic activity, and antibacterial activity, there is also an improvement with the use of bile acids when there is a presence of aflatoxins. And there is also histopathological. You can see that with aflatoxins, there is a rupture of epithelial cells and an abnormal lumen in the tubules. But then with bile acids, the histopathology of the hepatopancreas is improved. And then there is also another study with bile acids looking at the effect over digestive enzymes. These are different levels of bile acids from 0.1, 0.2, 0.3, and 0.5 grams per kilo. You can see that the activity of digestive enzyme is improved with the use of bile acids, and also the total antioxidant capacity and the levels of superoxidase mutase are improved, as well as the antibacterial activity. And then the use of bile acids also makes some changes in the population of bacteria in the gut. So you can see that there is a decline in proteobacteria, and there is increase in Bacteroidota, basically talking about the phyla of bacteria. So there is also some effect of helping in the dysbiosis induced by some diseases. So to conclude, the hepatopancreas is probably the most important organ in shrimp, and its health is affected by a diverse number of factors, including diseases, environmental stress, and toxins, among others. When the hepatopancreas is affected in its functionality, shrimp performance and health is compromised, with a significant economic impact for the producer. The diverse factors that affect the hepatopancreas health induce different histopathological changes. A profound knowledge of these effects over the hepatopancreas integrity may pose the basis for nutritional interventions oriented to mitigate their effects. And a series of additives and supplements have been developed that will favor hepatopancreas health under challenging conditions, including bile acids, phytobiotics, herbs, biotic products, immunoregulators, among others. And the correct use of these compounds to target specific hepatopancreas health problems is key for their success. So with that, I thank you very much, and I will be happy to try to answer any questions.
Thank you, Dr. Javier. Thanks for the pathological insights and aquaculture condition in Chile. And here are some questions for you. you can check in the Q&A area.
Okay, so I'm looking here at the questions. So from Y Liu, I have two questions. One, as you presented, R cells are lipid droplets, and the function of B cells is to produce the R cells. And then which factors can stimulate the production of B cells or increase the density of B cells in hepatopancreas? And which factors can make B cells damaged? Okay, well, I think that I mean the factors that can affect the B cells I already explained in some of the diseases. But every time you're thinking about how to improve, let's say, the number of these functional cells, I think that one of the important factors is nucleotides. Okay, nucleotides are basically directly involved in cell replication. So even though the body already has synthesized nucleotides in order to, perform this function, when there is a challenge, definitely there is not enough nucleotides being synthesized in the body to counteract this effect. So when you add nucleotides, okay, in the feed, then you support let's say, a more quick, let's say, recover of the damaged cells. Okay, so there is a direct effect there. And then, of course, the other things that you can do is to try to protect the cells from oxidation and an inflammatory response. And you can do that indirectly by using anti-inflammatory compounds, antioxidant compounds, and so on. Okay. Then there is another question. What causes aggregated transformed microvilli to appear in the hepatopancreas? Yeah, I'm not sure how to respond to that question. I don't know if maybe some other speakers can help me with that. But yeah, I don't know how to respond to that. Sorry for that. Okay, and then there is another question on, can you explain about melanization in shrimp and how it differs from necrosis when found in shrimp hepatopancreas tubules? Okay, yeah, melanization is basically induced by melanin, and that's coming from macrophages. Okay, so when you have an inflammatory response, you can have this melanization process. Necrosis is more a more chronic effect. Okay, so necrosis is when you have destruction of the cell. Okay, so so melanization is more related to an inflammatory response, and necrosis is of course, a much more severe response of let's say, chronic inflammation. Okay. I hope I was